Hello, everyone. Welcome to Meet Menaca, celebrating you. Good morning, good afternoon, good evening, wherever you are in the world. Welcome to episode 24 with Dr. Naushad Khan, who is an associate professor who is going to speak about COVID-19 today. So welcome to the platform, Dr. Naushad Khan. It is a pleasure and I'm honored to invite you. And particularly, he's from the same part, the Eastern Sri Lanka, which I'm proud to say. He's an associate professor and consultant in emergency medicine in Doncaster and Bassetlaw NHS Foundation Trust. I know that he has a passion for flying, and I'm sure there are plenty of things which I still don't know. The first question to you is, I know you are a professor or associate professor in emergency medicine. So how did you become passionate about this topic?
It's very interesting. As you know, in the UK, so all the patients come to the hospital, they have to come through the emergency department. So we are the doctors or nurses or whoever the staff working with us, we are the people will see those patients the first time. Then after that, we will move the patient towards the medical unit or intensive care unit wherever appropriate. So because this is a new medical problem, so you've never seen in the world. So somehow I was passionate about that. And then after that, I was learning and I was giving different interviews and all. But I have another concept. As a professor, associate professor and consultant, at the same time, as a doctor, we have to treat the patient. That is one aspect. We have a 50% job. We have to educate the other people as well. That could be a staff member, could be a general public. So that is also a part of our role as a doctor. So now I can ask the question, if we are not doing this, and who will do that? Are we expecting this from the politicians? That's the question here. So that's why we are doing it.
Point taken. Beautifully explained. Thank you. So we have been gripped with this pandemic across the globe for most of 2020. And now we are in early 2021. And still, we are, at least in the UK, still under lockdown, and there's no sign that it will go away anytime sooner. Can I ask you, if and when will we get back to normal pre-pandemic, please?
This is a $1 million question, so everybody asks nowadays. So when are we going to come back to normal? Right, let me explain in my way of approach. The situation what we are facing now, you know that when we watch these Tamil movies and the Indian movies and all, there will be a lady, somebody wants to force her to marry someone, whether she like it or not, okay? So she has to marry. So there will be a person, we call it villain. So villain will be behind, probably her father or someone. No, you have to marry this man. Okay, so you have to live this man. You have to learn how to live with this man. Okay, so that is the situation we are facing. Nobody like to face this, the virus problem. But continuously we are facing the problem. Now that we have a situation, how can we change ourselves? How can we change around us, and how can adapt our situation and move forward? Already marriage done. So you already accept, whether you accept or not this man. Now that virus is going to be there for some time. Some time means it's not a small time. Probably 50 years, probably 100 years. Who knows? Because in 1918, there was a flu virus still with us. So the same situation going to happen. Okay. Now I'll come to your answer, the specific answer for your question. There's a calculation for this. When will this be a semi-normal or the close to the normal situation? When you ask that question, 80% of the population has to get, or maybe they have to get some sort of immunity towards this virus. So that immunity you can achieve from two mechanisms. One is from the vaccine, yes, of course. The second is you have to get the disease and get the immunity. There are two ways, there's no other way. So to get the disease, there's a problem, because if you have a vulnerable people, so they can't get the disease, so then they will get a dangerous problems, and probably they will lose their life as well. So that is, you can't accept. But young people, yes, fair enough, they can get the disease and they can develop the immunity. But there's a big but. How long that immunity will last is a big question, because that maximum so far, whatever the information we have so far, 150 days, that is a maximum. After that, that immunity level will come down. So now we know that these are the two mechanisms. So we have to reach the population, 80% of the population, we have to get that immunity. For that, and can you calculate the small calculation I will tell you? So far, we have vaccinated in this country, in the UK, 3.2 million. This is yesterday's data, probably a little more today. So if you vaccinate for maybe 5 million people per month, then you have to roughly 60 million population. If you calculate that 80%, that will be around 50 million. Out of this 50 million, give a 10 million for the disease protection, then the 40 million you have to vaccinate. So if you want a 40 million vaccinate, that will take around 8 months, 7 months, whatever the things once. So the government is believing probably this will reach up to September, October. That is the period we can come some sort of normalization. That normalization I have to explain later on, but not completely wherever we were. That is slightly different. Now I believe I answered the question.
Sure. Thank you, Dr. Khan. So I am going to represent my audience's question, which comes up in conversation repeatedly. As you mentioned, we know that 3.2 million people in the UK have been vaccinated. In the world, 7.2 billion people have been vaccinated so far. The question to you is, will these vaccines work?
Good question. The real answer is nobody knows. Nobody knows. Okay, that is a real answer. You can manipulate the answer, but that is a real answer. Because normally, if you develop any vaccine, they will run the final trial for 1 year. So we did not have that time. In the 1 year period, 3 months, they will check the immunity level, that antibody level. The 6 month, they will check it, and 12 month will check it. And then we will decide how far that will go around. Some diseases that will produce a long-term immunity, and some diseases for a number of years. For example, tetanus injection, if you give it maybe a full course, that will protect for 10 years. So the similar like that, different disease, different period of time. For in this case, we did not have a time. That's a problem. So we calculated the risk. Now we started the vaccine. We did not have any other choice. As I said, this is the same situation. We are marrying someone, we have no idea. Okay, we don't like it. So that's the situation. Now we have to wait and see how long this will last. So that is the current situation. We don't know yet.
Okay. Thank you, Dr. Khan. And for those who are non-Asians, we are talking about the arranged marriages where people get married to people who they don't know prior to marriage. Okay, so it is almost becoming mandatory. There are many discussions going around thinking we might not be even able to get a job or travel without this vaccination. What are your thoughts on this?
This is a really good question. Whether we like it or not, we are going to be virtually forced to take this vaccine. The travel agencies will ask you, where's your vaccination card? Or maybe you have to bring your PCR. Even the job will tell you, okay, so we can't give you a sick leave unless we are giving the vaccine. You have to take the vaccine, otherwise we can't protect for those things. So these kind of things will happen. Recently something happened for me, probably you might like it what I'm going to say. Recently I was offered the vaccine. I went to the hospital. I'm a bit of worried about this, I'm not very good with the needles. So I told that, I called my wife, asked, really, do you want me to take this vaccine? So far I'm okay. So shall I skip it and shall I take it later on? And she told me immediately, don't come home. Don't come home, okay? That is a choice. So you have to take this vaccine. You're protected, and then only we will be protected as well. So that is the situation now, okay? Whether you like it or not, you have to take the vaccine. Nobody will force you, but virtually you will be forced. That's the thing.
Sure. Thank you. So, there are different types of vaccines. So far, we know that there are 3 types, might be some more coming, who knows?
Yes.
So how do we know which one to choose? And also on top of it, the Pfizer vaccine, initially we were all told that there has to be a 3-week interval before that, between the first and the second dose. And now they are saying it can.
Your mic is muted, I believe. Can you check your mic?
I think,
Oh,
I think someone else.
Yeah.
So sorry. So I think someone accidentally muted me.
That's fine.
Okay. So what I was about to say is there are 3 different types of vaccines. And on top of it, one particular vaccine, Pfizer, we were told initially between the first and the second one, there has to be 3 weeks interval. And now it has changed. So, who decided and how it is decided? And
Okay.
do you think
good.
if we are vaccinated like that, it will still prevent us from whatever it is supposed to do?
You've collected a really good questions. It's a very popular questions even in our hospital. Okay. So yes, of course, there are 8 different type of vaccination production, but in this situation, yes, of course, as you said, the 3, but commonly we are talking about 2. The first one is a Pfizer, the vaccine. So that is a mRNA type vaccines. That we never tried these vaccine technology in the vaccine production, but the technology was tried some other cancer research and all. So fine. The second type is Oxford, the vaccine they are developing one. And the same technology being developed in India and also China. They are producing, the several companies all over the world, they are producing the vaccine. At the moment, the first vaccine was introduced by the Pfizer. And now, yes, of course, they said, you have to take this vaccine first dose, and after 21 days, from 21 days onwards, you can take the second dose. Now they're changing the thing. You have to take after 3 months. Am I right? Yeah, that's the question. Yes. So there's so many people who are asking, even in our hospital, there was a big discussion. The answer which I'm going to give basically from the government, and also I agree with that answer as well. You might accept. I'll give you an example, then you will accept that. You have two children, okay? Now you have 2 doses of vaccine, both of them are equal, same type of vaccine. So you have 2 children. If you give 2 doses 21 days apart for one child, that child will be protected from the virus. 95% protection will be there. Yeah. That is one option. Or if you give 1 dose only, the protection will be 75%, not 100%, 95%. Now there are 2 choices here. Basically, you can give both doses to one child and leave the other child unprotected at all. Okay, so just leave it like that. Let it happen, whatever happen. Or you can give 1 dose each child, protect for 75%. And by some time, maybe after 2-3 months, we can get more stock of vaccine, because we don't have enough stock to give this vaccine. This is not a UK problem. This is a global problem all over the world. Whatever they are producing, they have to distribute this vaccine for all over the world. So maybe different developing countries, developed countries and all. So in this situation, I think the sensible decision will be, you give the vaccine, the first dose, as much as possible for many people, you cover many people and protect them for the time being. And by the time the Oxford vaccine will come, that also already started to roll up. And the problem is the Oxford vaccine, the production will take some time. So they are buying some time and protecting the rest of the people. Now, I already mentioned that the total coverage, probably 30-40 million population. So it's not a small number of people. We can say, just argue with that, blame the people. The blaming is not a good thing. As a leader, we don't blame. We have to come up with a solution. Okay. So if you think sensibly, I think it's a sensible decision.
Sure.
That's my personal opinion if you want to take it. Yes.
Sure. Thank you. Thank you so much. So do you think if we are vaccinated, coming to the next, next level, can we absolutely be sure we are safe? Or are we going to be able to prevent this transmission going forward? Because otherwise we are almost, like you said, we are being, twisted to do it. But if once we do have it, then are we going to be sure that we are safe and we will prevent this transmission to others?
Yeah, really, really good questions you have collected now. We have to understand the vaccine. What does it do? Then we will come to the conclusion. when you take the vaccine, that does not mean you will not get the infection. You will get the infection. That means your virus can enter into your body. So the infectivity will be there. But because of the antibody you produce because of the vaccine, that will not give you a severe disease of the COVID-19. So you will be protected from the severity of the disease and you will be fine. If you get this virus, that the antibody will neutralize most of the viruses. Somehow you will escape from that. You will not get severe symptoms like a shortness of breath, whatever it is, whatever the problems you are facing. And also, when you get the viruses, that virus can spread to another person as well. Mm-hmm. But that the spreading, the viral load will be slightly low, because not slightly, significantly low, because your antibody will destroy most of the vaccine. So the viral load will be low, but still infectivity will be there. So what I'm trying to say, your infection will be there, but you will be protected, whoever have taken the vaccine. At the same time, spreading will be less than before, but still the spreading will be there. So in summary, you have to wear the mask, you have to maintain whatever the social distancing and measures, washing the hand and all of whatever we are following, we have to follow for some time. We are not coming back to the normal stage that soon. That will go maybe a few years time. That is my expectation, and also that will happen.
Sure, thank you. So going from there, from the time the pandemic started, beginning of last year, it was, we opened up hospitals. For example, Nightingale Hospital, we opened different, places to just deal with COVID-19. But how has the understanding of COVID evolved since the pandemic started then to now?
It's a lot. We learned a lot from these viruses. The questions you ask a little bit medical oriented, but anyway, I will do my best to explain in a simple language. So initially we thought this virus is very similar like SARS or MERS virus. Mm-hmm. The main problem is the acute respiratory distress syndrome, and also the cytokine storm mechanism is the problem. So that was our initial understanding. Probably I also presented, I remember that maybe in the March, April time. Now, maybe 4 or 5 months ago from onwards, we understood the pathophysiology completely different from those viruses, okay? Let me put it in an easy way. The main problem with this virus will go and basically in our red blood cells, that red blood cells, there's a chemical called hemoglobin. The hemoglobin is responsible for carrying the oxygen from the lungs to other part of the body. So this virus will go and break the hemoglobin. So what will happen? The oxygen carrying capacity will be extremely low. So we will struggle to breathe because the less number of red blood cell and the hemoglobin. So we can't take the oxygen to the other cells. So the rest of the body will push the red blood cell towards the lungs. So we will feel like a shortness of breath, like an air hunger. If you want to explain with another example, when you go higher and higher, and after maybe 10,000 feet, what will happen? The oxygen, the taking capacity will be less because of the pressure will be less. Because of the pressure less, and we will have an oxygen hunger. The patient will present exactly like that. And also, probably you heard about that, maybe you would have seen some publications, that when they do the postmortem, they identify the clots in the lungs. Because these red blood cells move towards the lungs, hypercoagulability, and that will cause these kind of problems. So this is main pathophysiology. The initial part of our management, we depend on the intubation. We thought we need a more intubation facility. That's why we opened this Nightingale Hospital and all these things. Then we realized, no, intubation is not the correct treatment. The correct treatment is initially we had to, identify this hypoxia because of this the hemoglobin breakdown, and we have to give the hyperbaric, high pressure oxygen to the patient. That is the main key way of management. For that reason, we started we call it as a CPAP and BiPAP in our hospitals. We do that, the management point of view completely different. On top of it, the cytokine mechanism we understood very clearly, the function of the vitamin D and the importance of the vitamin D we understood, and also the immunological mechanisms and maybe reduce the inflammatory problems. And we identified that that's why we introduced the dexamethasone and other anti-inflammatory drugs. So the management point of view also, we significantly improve. Yes, of course, there's a significant improvement in the management. Yes, sir. Yeah.
Sure. Thank you. Thank you so much. There's emerging evidence that to show minority or particularly Asians and Blacks, we are more prone to this infection. And, there is evidence emerging all the time. So what, particularly you coming from that part of the world as well, or being part of the minority or part of being an Asian, what are your thoughts? Why is it affecting us more?
Very good question. Is a bit of a complex area as well. So far, we did not publish the report, the official report, but still we have some sort of understanding what's going on. We are Sri Lankans. I'm Sri Lankan, you are Sri Lankan. There are many Sri Lankans in the panel. So we are lucky in the Sri Lanka, we vaccinated for the BCG vaccination, almost 100% vaccinated in our country. Because of the BCG vaccination and there's a cellular immunity, because of the cellular immunity, we are a little bit more protective towards this, the viruses. So that has been published a few papers. That is one side. Now you ask the ethnic minority people are being affected. Why is that? This also I have to explain, this very interesting area. In our immune system, there are two types of immune system. One is, we call it as an innate immune system. That means built-in, basically like a white blood cells. In these cells, doesn't matter the COVID virus or any virus or bacteria, whatever it is come inside, that will work immediately, that will kill those things, that will protect from us. That is the basic, every single person will have that, no problem. But that depend on their genetical factors as well. So that will decide from the genetically. So each and every ethnicity will have a genetic different origin. So they have a different capacity of this innate immune system. So some ethnic origin people will have a very strong one, some people will be less one. So that's why they are affected in a different way. That is one type of immunity. The second type of immunity is adaptive immunity. That means there are two elements. One is antibody. That's why we are giving the vaccine and producing the antibody. And the second one is the cellular immunity. That is actually the T cells, and there are some different type of cells that will produce the mechanism. So it's this protective mechanism is too complex, not that simple to explain the things. So to answer your question, so some of the immune things decided by ethnic origin and also the genetically also different, that is deciding actually the gene decided factors are there. So because of that, some people will be affected more and some people will be less. On top of it, there are some other factors involving, obviously, socio-economical background and how their living conditions and how their immunity level, the food and how they are eating and everything. So many factors are involved, environmental factors, so many things are involving in this. We can't come to the answer very simply to that question. So that's why I said it's a very complex area.
Thank you so much. It's good that you mentioned about vitamin D. I myself have to take supplements for vitamin D. Is there any other supplements people need to take to manage or prevent COVID-19 a bit better, please?
Yes, the program, the main purpose of this program, we are not talking about talk about this COVID-19 virus. And now most of the people have a PhD on that nowadays. Okay, so many programs, so many doctors were talking about this. So we are not going to talk about now. What we are going to talk about, how can we move forward? How can we adapt to the situation? How can we protect ourselves? Now we have to understand. Now, as I said, how can we live with this virus? How can we protect? Main thing is regular exercise is very important. The exercise is important to build up and maintain our immunity as well. The second thing is hydration is very important because this virus will bring a hypercoagulability stage. So that is important. The third one is vitamin D is really important because the cytokine storm will be managed by there's a molecule called SPM molecule. The SPM molecule produced by vitamin D and also omega-3 oil. Omega-3 oil, probably if I want to explain in a simple term, the cod liver oil, Sri Lanka, we used to take fish oil or something like that. Okay, so that will produce the SPM molecule. The SPM molecule will control this cytokine storm. So vitamin D, omega-3 oil, and zinc is important for maintain our immunity, and vitamin C also important. On top of it, when you come to the some patients, if you see that more than 50 years old, normally the GP will prescribe the aspirin 75 milligram for the prevention purpose. Please don't stop that. Continue that aspirin, okay? Because that will reduce your hypercoagulability. So that is good for this kind of problem as well. So that is our basic thing. And be strong. Be strong, okay? Whatever happened, okay? So now we have to move forward. And if you think too much, your immunity level will go down. So that's going to make more problems. So you take all these things and you do your work and adapt to your situation. For example, we did not have these kind of conferences with these kind of things maybe last year. So we changed ourselves. So maybe next year we will find out some other things. So, and we will keep moving and we will do our job and we will live whatever it is, we will move forward. That's the strongness we have to bring. That's the spirit we have to bring. And don't go down and think about, oh, what's going to happen. Yes, of course, there will be so many problems. And anyway, that problem will come. Now this is the good news I'm talking about. I'm going to tell you some bad news as well. Some bad news, okay? This will happen. Take my word. Right, strains. You ask about the strains, okay? And maybe variant or different type. This will come. This virus, every day, there will be thousands of millions of mutations will happen, but not all the mutations are important. Not all the mutations are important. Only few mutations will be dangerous for us. For example, now, yesterday or maybe a couple of days ago, we heard about one of the strain from
Brazil.
Yeah, that's right. And before that, we had another variant. Something will come from Africa and other places. Every part of the world will bring some, different strain, because whatever we learn, whatever we do, the virus also will work with us. And that also we learn. That will change. That will bring the things. So we have to come up with a solution for that. Now, the problem is, now you're going to ask the next question. I can save you time, because you're going to ask the question, okay, will this vaccine work for these things? That's the question you are going to ask. Actually, nobody knows. The good news is, but Pfizer company said, because of the new technology, they can change the vaccine type, or maybe they can modify the vaccine maybe another 2-3 weeks time. So they have a plan for that. So as I said, we have to learn and we have to move forward. So that is the answer for that. And another bad news, this is actually happened already. And probably you heard about that in Denmark. There was an infection.
The mutation from animals.
Animals, okay? Will this happen? Yes, possible. Why not? This virus is learning, because the virus is thinking, these human beings are bad. These people are giving a lot of problem for me. So I have to jump some other place. Now already jumped to one of the animal, that is minks, okay? And now because of that, then again that jump back to the human being. So the Denmark people panicked. We don't know what kind of implication from this. We don't want to be another Wuhan here. So they decided to kill all the minks. They killed already maybe around 15 million minks. So these kind of things, will that happen to another animal? Who knows? Whatever it is, we will find a way, we will move forward. That's a spirit.
Sure. Thank you. So perhaps it is the strongest of the fittest after all, isn't it? Like, whether it is a virus or the humans. Yeah, I guess
that's the way. That's the way we will see.
At this moment, we are fighting it out. And For people who panicked about Pfizer vaccine not being there for within 3 weeks, perhaps it's good news. If they are going to be able to adapt for the new variant, why not wait for a bit longer and get that vaccination, which is a bit stronger and which is more suitable, I guess.
I
Go
would
with the plan.
I would advise to take the vaccine, because government and ourselves, we have a plan, some sort of plan. How can we beat this problem? Only way we can beat this problem, get the disease or get the vaccine. These are the two choices. We don't have any other choice. Okay.
Sure.
So if you reach that number, whatever the number I already said, 80%, then that will produce the herd immunity, and we can protect the rest of the people, whatever the balance. So we have to get this vaccine and we have to move forward. Yes, of course, there are so many questions about this first vaccine, produced by the Pfizer, and because we never tried in the vaccine development technology, and also now already we have taken 3.2 million people have taken only in the UK, and worldwide also there are lots of vaccination has been done. But Oxford vaccine, if you ask me the personal choice, yes, of course, I prefer towards the Oxford vaccine, because that is a traditional way. We develop so many vaccines in the same technology. It's very, very difficult to go wrong. So in that case, I prefer that. But still, that will take some time. Because of that reason, we have to come up with a solution. I think I would encourage the people, if you are offered the vaccine, please go and take it. Okay. Sure. Otherwise, like my wife said, nobody will accept you from home.
Thank you so much, Dr. Khan, for being so candid and transparent about your choice of vaccine as well, which I'm sure it's at some point I would have asked that question. So thank you so much for answering that in advance. So, we are almost reaching the end of the show. I just want to ask you, we now know we will have to learn to live with this, as you said. So how can we learn to live with this? What will the new normal look like? And, what are the new adaptations we'll have to make to be able to successfully cohabit with this virus, really?
The new normal, in probably my prediction or imagination, whatever the factors around, I studied these things, and then this is what my expectation, okay? Because we never seen this before, all right?
Sure.
The new normal will be after September or October, probably there will not be much restrictions. So there will not be tier 4, tier 5 and all these numbers. And the schools and everything will be open, and maybe even pub, and, pub is part of in the UK culture, so those things are important things. So that will be open. So there will not be much problem. And the thing is, but still we will maintain some elements of protection, probably, preferably we have to wear the mask. Preferably we have to, maintain our distancing, social distancing. And that you remember that those days, 2 meters, don't even think about closer.
Yeah.
But now the 2 meters becoming slowly coming closer and closer, right? Probably a little bit closer. But hugging will be slightly, a difficult task. But anyway, you can't avoid 100%. Otherwise, nothing will be possible. At the same time, the washing the hands and maintaining our, these kind of protections will be there. Even the cinemas will be open, but there's a question, how are they going to maintain? Some sort of protection will be there, okay? But we are not going to go for a complete, the normal, whatever we had probably in 2019. I don't think we will go very soon. That will take maybe few years, 2-3 years, maybe. I'm thinking about up to maybe 4-5 years. That's what I'm thinking.
Wow.
Yes, but as long as we can move around very freely, we can move. For example, now I had to visit Sri Lanka because my mother passed away, right? She was very ill and he passed away. I couldn't visit. So why can't I visit? Because they restricted the the borders and all flights and everything. I can't visit. When you go, you have to be quarantined for 14. So these kind of things will go away. And now you are thinking about our country, in the UK, but at the same time, you have to think about other countries as well. So if you want to visit, they also need the vaccinations and their protection as well. That will take a little bit longer time. So this will take all together, I'm thinking about 4 or 5 years, but at the same time, we will come some sort of normalization, and we will adapt to that normalization, and then we will move forward. That's what I'm thinking. Anyway, we are going to live with that, right? You have been forced to marry, so you will live with that person. That's it.
Okay. Sincere condolences about your mom. I'm really sorry to know that. And many friends who are on the platform know my mom fell ill.
Everyone in this platform probably went through some sort of difficulties, and we all respect each other.
Yeah, and I couldn't go to see her either. So, I think, and like you say, many people had many things planned, and, either they lost someone, they know someone who lost or fell ill. Coming to that point, okay, if we have to live like this for a few years, I think the symptoms are very, very important, because sometimes people have symptoms of loss of taste, loss of smell. It's the textbook symptoms are displayed. And then when I speak to some people, they say, they had a bit of tummy upset and a bit unwell or a bit lethargic or tired, but they didn't have anything else. So if we are going to start living like this and cohabit with other people, how are we going to know what to look for so that we can prevent this transmission going forward?
That is a interesting, but it's a difficult question. Basically, as I said before, genetically born with some protection. That is person to person is different. Even ethnically, that is different. And area-wise also, we are from different part of the world. So that also different. And so the symptoms we are producing depend on mainly, there are a number of reasons, mainly wherever we have the receptors, where is the virus go and affect, that will produce the different type of symptoms. For example, I will say, if that virus go and affect mainly in the respiratory area, so then you will get a shortness of breath and all. At the same time, if this virus go and affect in the gastrointestinal system, our bowel movement area, because the receptors are, if there are more receptors, then they will get a diarrhea-like features. And also this will go and affect in the, the smell related area, and so the symptoms they produce, they will be different from one person to another person. And the protective mechanism also will be different from one person to another person. So that's that's why they are producing different symptoms. And nowadays, I think recently the number of symptoms are changed. In the initial part, we did not realize. Now that we realize a number of other symptoms also producing. For example, there's different taste and smell and all these things that we identified recently. So now I think some people immediately, it's a very interesting thing. Most of the patients say this, and first symptoms they come up with, recently I observed this, most of the patients say, I feel like a complete tired. I don't want to do anything.
Sure.
That's all. Then that symptoms go away for maybe 24 hours. Then immediately after that, suddenly they lost the smell. They can't even smell anything. Then they start other symptoms. So that is another way of presentation. And also, I have to add one point, which is another important thing that most of the people are nowadays, they are asking. They are talking about that new variant, which is dangerous, or how, whatever it is. We have to understand, this is another variant. The problem with this variant is the spreading faster than the previous one. But otherwise, there's no documentation. This particular variant will produce very severe disease. You have to understand the difference between. So this is not a severe. The severity means the spreading fast. Let me put this way. This is around 75% faster than the previous version. For example, for a short period of time, if a previous virus spread 100 people, this will spread 175 people, something like that. So that will infect very fast. That will produce so many people with the disease. So that will produce so many admission to the hospital. That is the problem with this virus. And also, sorry, Menaca, and probably you'll forget that I have to answer this question as well. Somebody asked me recently, maybe yesterday also, they asked this question. And, I have one of the nursing staff, she had the vaccine 21 days ago. And then she got the infection now. Then they all surprised, okay, why? What is this? So you had the vaccine, now after 21 days you are getting the infection. Is it possible? Yes, of course. It's a simple logic, because after first dose of vaccine, and they are protected for 75%. That means if you take four people vaccinated, 3 people will be protected, one person can get the infection. So that is not 100% protection. So still, that's why I'm telling, still you should take all the precautions at the same time. Yes, of course. I think I answered the question, and also I don't want to forget, because I'm getting old nowadays. So I want to cover all the things and what are the important things.
I'm sure you're not getting old at all. Okay, thank you so much for that. Thank you so much. I have definitely understood about the symptoms and COVID-19 and how it works and why we should take this vaccination better than before. So thank you so much for that. For people who are on the Zoom, please get ready with the questions, because you can either come on the video and ask Dr. Naushad Khan the questions yourself, or you can put it through over the chat, and then you can send it to Kirubay will send it to me, or otherwise, So before we go to vote of thanks from Dr. Kanta Niranjan, I am going to announce the next week's speaker. It is Krishnath, who is familiar to many of you on this platform. He has spoken with us before, and he's going to be speaking about dealing with discrimination, which is another topic close to my heart. And I think it's really, really important that we address it head on and face it, because I think time for us to hide from these facts and face it and deal with it and speak about it openly. So that's why he's going to do. He's another great speaker. So I can't wait for next week to see Krishnath coming and speaking about that. Over to you, Kanta Niranjan, to give the vote of thanks, please.
Thank you very much, Dr. Naushad Khan. Very inspiring. Excellent talk about COVID virus and the current problem. I'd like to say a few words about Dr. Naushad Khan. He is 20 years experience working in this country as in emergency medicine. He qualified from Sri Lanka and he moved to UK in 2005 and completed various examinations, including master's degree, diploma in public health, and also emergency medicine. He is a member of emergency medicine, Royal College of Emergency Medicine, and also a member of National Emergency Medicine, CESR. And he's an application assessor panel. We are very proud to say about your position, and your talk today was immensely helpful for many people. He is passionate about teaching and transforming emergency medicine training system. When I asked him to talk, he told, one of our duty is to educate the public. This is what he told, and he immediately agreed. And thank you very much for that. On behalf of Meeting Menaca, I really like to give my vote of thanks. And also, I want to say the narrative you have given on COVID-19 has been excellent, because I feel the government narratives has been reductive and polarized. And this has led to false dichotomies between contrasting position to us. And many argue what is crucial is either COVID health protection measures or their impact on their job, economy, mental and physical well-being, and wider problems. And today you have answered many of our questions, and I really like to thank you, and we would like to see you again in another form or something, but we'll meet again. Thank you very much, Dr. Naushad Khan.
Thank you.
Thank you, Kanta, for that.
And we have to introduce her. She is one of our senior consultants. She is a physician, so a very experienced consultant. I'm sitting in front of her.
Thank you, both of you. And I have requested Dr. Naushad Khan to do a webinar for us. It will be on the 6th of February, at 11 o'clock in the morning, UK time. I've tried to adapt to his availability. So, and because as you know, at 3 o'clock we have the talk show, so we had to work around it and come up with the time. So he has kindly agreed to do, and I'm sure it is going to be immensely valuable. So please do join us on the 6th of February again to listen to him present his own presentations as a webinar on the 6th of February. Thank you so much for everyone who joined and in Facebook, and a huge thanks from Meet Menaca team and from Dr. Naushad Khan for attending, and hopefully you learned. I definitely learned a lot. So we will see you next Saturday at the same place, same time. Until then, be happy, stay safe, and keep smiling.